Everyone. So I am going to cover some information about your mock boards exam. So we are going to do our best to mirror your credits clinical board examination with your mock boards. There are a couple slight variations. All of you will complete a mock clinical board exam prior to completing any of your actual clinical boards that are required for licensure that you will be completing in the next couple months. So our mock boards will take place in the next couple weeks, right? They are intended to prepare you for clinical boards. So think of them as a dry run, right? So a lot of this is also helping you get a little more familiar with some of the paperwork, especially if you are doing a patient-based exam. So we will be using the same credits paperwork and point system that during this mock board as you will be utilizing during your credits exam. Right? So whether you are registered to take a mannequin or a patient-based exam, you will complete the same mock board exams with one variation between the two, and I will tell you what that is when we get into the paperwork. You will also, in addition to your mock board exam, everyone will complete a separate calc detection and periodontal probing exam on one of the 4 calc detection typodonts, right? This is done outside of mock boards, so this has nothing to do with the mock boards that will take place with rifle patients on assigned Mondays. You will check out the calc detection typodont and complete a specific form, which I will show you here shortly. That's a calc detection and a perio charting of a designated arch, and you have 30 minutes or less to complete this portion. And then we have discussed already in Clinic Theory 3 how you will complete an OSCE EI exam. The study exam, which pulls from the 40 some odd EI OSCE style questions that I have created, will give you unlimited attempts. It will pull 16 questions, just like your OSCE. Each time it will pull different questions from that test bank of questions that I have. And then when we do the OSCE EI exam, that will be in class during Clinic Theory prior to taking your credits exam. And again, everyone participates in these 3 different ways, regardless of what type of exam you are registered for. There's a variety of mock board type exams that we do that prepare you for both types of exams, right? Because we need you all in our classroom dental hygiene program setting to be evaluated in the same manner. All right, so let's talk briefly about your mock boards candidate exam packet. Get that to open up. So I will have these exam packets prepared for you when you come to clinic. Right? You are not responsible for printing these off, which I need to update the date because this is from last year, so those will be updated. Why it's all in black right now, I couldn't tell you, but that is currently the background we're going to go with. So hopefully maybe it's a little easier for you to read. So your packets will be on white paper. We will talk about the timing in a second because I have another document for that. So let's just go on to the exam packet, okay? You are going to fill your name out here. Your candidate number for this is going to be your dental hygiene program number, right? For example, my number when I was in school was 26P. That would be what I would put here. That's what I would put up here in this little box. right? You were going to write the date that you take this. These things do not apply. But not for your mock board. This is something you would need to do for a patient-based exam. You are also going to use the credits patient medical history. So all of these screening forms, paperwork that you do, most of your work is going to be done, except for your digital x-rays, will be done on paper. Once the exam is over, part of the process is scanning that paperwork into the patient's chart and then making a services rendered and a ledger note match that. Okay. So where you will list the name of drugs, the reason that they're taking it, the last day that they took it. For rifle, a lot of times you have minimal drugs that patients are taking. You will get the patient's signature there. I do not know why this is showing up like this, and I really don't like it. All right, we're going to do a video too. I'm going to figure out what's going on with this, and I will be right back.